Dr. Halberstadt, could you talk a little bit about panic disorder?
Panic disorder is when people get extremely anxious without any apparent cause, where the person feels extreme anxiety bordering on terror. They get nauseated, chest pain, rapid heartbeat, sweating, chills, feeling detached from the world, and they can't control it. The fear when you have a panic attack, because you don't know the cause of it, an emotion is so intense that you can't stop it, so they fear they're going to go crazy. There are people who are subject to having panic attacks. Most people who are prone to having panic attacks always have this feeling that something catastrophic is going to happen to them. They're preoccupied. For example, if a person were in the mall with two other people enjoying oneself and suddenly there's an onset of anxiety, the person will fear it, because often when we feel anxiety, we suppress the thoughts. We don't think about what's making our anxiety, but a person is prone to something catastrophic is going to happen, will get scared of that anxiety, because that to them indicates something terrible is going to happen. That escalates into a panic attack. Once they have a panic attack, then they anticipate having more panic attacks. It keeps them in a state of chronic anxiety. What happens actually, they fear their own anxiety, because anxiety means to them that's going to usher into a panic attack. And they can lose control of themselves. Some people, for example, can't leave their homes. Some people can't drive to work. Some people have panic attacks at work. It totally disrupts one's life. In my treatment, it's a three-pronged approach. I use hypnosis. I use hypnosis because when people are in a trance, they're very, very relaxed. And I have them make a fist and squeeze away the anxiety, because once they have control, they don't anticipate they're going to have a panic attack because of control. I also use medication like Xanax to put place on the tongue at the time they think they're going to lose control of anxiety. Xanax functions by sedating a person, relaxing a person. And then I use counseling to address the issues, why they feel so vulnerable, because that's a belief system. What I try to demonstrate them in therapy, that they're taking an improbable event because of their anxiety. They make it certain. Once they begin to understand the probability, accept the probability, it will help eliminate this fear something terrible is going to happen to them.
Interesting. So, in your practice, do you take most types of, just as a practical matter, if someone has insurance?
Yes, I'm a provider for almost all health insurance companies, so that's not a problem.
And for someone to get in touch with you, how would they do that?
It's 248-457-9667.
Well, Dr. Halberstadt, I appreciate your time, and until the next segment, thank you.